Case 2 is a common plantar heel pain presentation, with risk factors including occupational demands, foot type, and work-specific footwear. Patient 2 is a female nurse with supinated feet and plantar heel pain. This is a common female presentation. She's 51 years old, around 75 kilos, and has diabetes. She works long hours on her feet in nursing shoes. She has a moderately supinated foot with lateral instability and an ankle equinus. She presents with a painful left heel of 8 months duration, with pain at the fascial origin and into the medial arch. It is worse first thing in the morning and after a long shift. She responded positively with strapping. Let's go through the pathway for orthotic prescription. Step 1. Let's pick the DOLA Pro style for this patient. Her nursing shoes are similar to walking shoes and have a nice removable insole, so a full-length device is ideal, and there is plenty of space, so we'll go with a full-featured DOLA Pro full length. And then based on her body weight and control required, we'll use the softer density Pro 70. Step 2. Let's look at her foot type to see what prescription we need to add to the DOLA Pro shell. The fully reinforced medial arch support of the DOLA Pro will reduce the load and strain on the fascia during loading, stance, and propulsion. And with a moderately supinated foot, we're looking to increase the dose and the amount of lateral orthotic reaction force and mid-foot support. To do this, we'll add more medial arch support with a 5mm pour-on arch pad and more lateral support with a 4-foot valgus extension. The 4-foot extension is thicker on the lateral side to tilt the foot inwards, supporting the supinated foot and stabilizing the lateral ankle. The flat plantar surface of the DOLA Pro allows fast and easy application of these self-adhesive pads and wedges. Step 3. Now we'll need to look at the pathology or tissue stress and see if there is any further prescription required there. The previous modification for foot type will help reduce the strain on the plantar fascia and medial arch, but we still need to address the ankle equinus component, so we'll also include a heel raise in our prescription. We'll also consider adding extra cushioning in the next step for top covers. Step 4. This patient has diabetes, so we're looking to not only add extra cushioning to help with the plantar fasciitis, but also to reduce the shear force on her feet to address her diabetes risk factors. We've chosen the diabetic anti-shear top cover, which will fit nicely in her shoes as they have removable insoles. The aim of this orthotic is to provide a moderate dose of lateral orthotic reaction force and cushioning for the supinated foot, along with a top cover to reduce shear force and provide extra cushioning. So let's take a look at how we're going to make this in clinic. So we just take our DOLA Pro, and the first step here is we're going to be marking out for the medial arch pad. So we're just using a self-adhesive pour-on arch pad. Marking, this one's in the center of the arch, which is kind of one of the more common placement positions. You can place it more proximal or more distal to suit. Depends on your patient and whereabouts you're trying to add that extra medial orthotic reaction force. So we're placing that one just a little bit more in that kind of central position through there, and we're also going to be placing on the heel raise at the same time. So all of these are nice and self-adhesive, so nice and fast placement. They look nice and professional as well, all with a 3M tape, so it gives you the maximum amount of adhesion that you can take. Next step is to place on this 4-foot valgus extension. This is a triplanar wedge, so it's fairly unique in that it's going to be thicker on the lateral side and also at the distal edge as well. So we've got some clinical markings on the plantar surface of the DOLA Pro which make this placement quite easy. So we're just going to peel off the adhesive section through there and obviously place that on that dorsal on the plantar surface through there. And then it's time to trim that down, so just taking some scissors. All of these additions trim nice and easily, so it's just going to help when it comes to grinding time a little bit later on. Next up, we're going to be putting the top cover on. This is the diabetic anti-shear, so same thing again, just putting on some contact adhesive here. So we'll just place that on, or just cover that evenly onto the dorsal surface of the orthotic and onto the top cover. Spread it out nice and even, let it dry, and then we're just going to activate it with the heat gun. This is going to give it a nicer adhesion, and it molds into the heel cup a little bit better. Once again, placement, we want to start more distal and move back into the proximal heel cup. So take a little bit of time with this, make sure that you're getting nice even spread and the cover is nice, especially around that heel cup. The rest of it's going to cover quite nicely. We're going to trim this down with some scissors to make the final grind a lot easier, and then we're back off to the grinder to smooth it to get a final result. So the Diabetic anti-shear is, you want to go a little bit slower with this one. It's kind of a little bit more because of the extra cushioning in it. It feels like it rebounds a little bit more off the grinder, but just go nice and slow and at your own pace through here and get a nice finish. This is going to be grinding the pads down as we're going as well, so you're going to get a really nice lab kind of looking finish through here. If you just take a few moments, it's going to be worth it for your patient. And then we're just fitting it into the nursing shoe here, so nice and easy. Your patient can give it a test.